how did this artist create certain effects? And what effects did he create? And why is it important in this setting?
It's an interesting piece to feature right when you walk in, because especially being in a cancer center, like it's a very happy piece. Like I felt very joyful when I walked in here.
They're able to like relax and really focus on themselves and kind of ground themselves a little bit.
Mm-hmm. So in a way, kind of looking at artwork and looking at all the details parallels and will improve even their own skills in diagnosis. It's also showing them how arts and humanities practitioners have some of the same skills that medical practitioners have. We do research, we diagnose, we interpret, and so looking at art more carefully can teach them to observe more carefully too.
What does this make you feel? What does it make you think about?
When you come into this room and you look up, it's like I said, these angels are like spirits or angels that were coming to take you to the next.
It really just begs me to question, and it kind of halts me and makes me want to stop and just take a deep breath and just process, because it's really breathtaking and such unique sculpture.
Medical education programs that have students be able to immerse themselves in the arts tend to develop a greater empathy and compassion, and those are some of the provider traits that are necessary. Just being good at diagnosing and saving a life is just one aspect of healthcare, but truly caring for a patient includes that empathy and compassion piece. Many of the people that use the Chihuly Center are beyond the patients and their families, but also healthcare workers, and it can give them a place to get away and to meditate and take them away from that space for just a short while. Exposing them to these different modalities and walking away from it, we hope that they just take and embrace what's meaningful to them and what may help them in the future.
It has enough shape that it can kind of guide you to maybe what the artist was picturing, but then also enough ambiguity that you can kind of like draw your own conclusion and decide like what it means to you and what it looks like to you.
Hopefully find that our students, this has a positive impact on them, not just now, but as they become providers in the world and caring for patients.
I didn't know this was here, so yeah, this is really cool.